and she developed acute onset paraparesis. Now the neurophysician saw the patient and they said that this lady needs a MRI now because we were expecting that the severe LV dysfunction, whether it's an embolic episode or something. Now what to do about this case? This lady is having a non-MRI conditional single chamber ICD. Now the use of MRI in patients with implanted cardiac devices, whether a pacemaker or ICD or CRT, may raise concerns for the clinicians. And why we all have an apprehensions about it. Why we have the apprehensions? Because of the system, the pulse generator, the leads, the ferromagnetic. So what is the damage which can happen if you do an MRI or if you expose these patients to the MRI field? So you have a static MRI field, you have pulses of the MRI field, you have a radio frequency energy which is going through. So what damage it can happen? It can cause any kind of damage. It can dislodge the lead, it can increase the threshold, it can decrease the sensing, over-sensing, under-sensing, it can drain the battery completely, the inappropriate shocks can happen, or even life-threatening arrhythmias can happen. This is because there is a low voltage current which goes through the lead and cause heating. The heating can happen in the can at the pocket side, heating can happen at the lead tip. So because of all these apprehensions, even deaths have been reported in these patients when you expose them to the MRI environment. So that's the reason ideally MRI in these group of patients is contraindicated if it's a non-MRI conditional device. So what is the answer to this? One is give MRI conditional device to each and every patient. Next is, we know in the US there is a data that at least 2 million people in the US already have a non-MRI conditional devices. And it is estimated that more than 50% of these patients will require